Thank you everyone for attending today's virtual open house for the Certificate in Global Tobacco Control. At this point, you should be able to see our screen with the first presentation slide. I'm Kelly. I'm one of the admissions officers here in the department for the Applied Science programs, and I work with our team to assist students as they're exploring their options for continuing their education. I would like to introduce Dr. Joanna Cohen. She is the director for the Institute for Global Tobacco Control. Dr. Cohen, would you like to share a little bit about your background?
Sure. Hi, everyone. Good morning, good afternoon, good evening. Thank you so much for joining us. My name is Joanna Cohen, and I'm at the Johns Hopkins School of Public Health. I'm really pleased to be able to be with you today to tell you a little bit more about our certificate program in global tobacco control. I've been doing tobacco policy research for over 25 years now. I started doing work actually in the US tobacco state of North Carolina. And then I had the opportunity to work for a number of years in Canada doing tobacco control policy at the time that Canada was setting world precedent tobacco control policies, like the health warning labels on cigarette packs that we're going to see in the US soon, reducing tobacco sponsorship and advertising, tobacco display bans. So it was a great training ground for me to participate in the tobacco control movement in Canada. And now for the last 10 years, I've been at Johns Hopkins University and doing work in a range of low and middle income countries with the support of Bloomberg Philanthropies, and also doing tobacco work domestically in the US with support from the National Institutes of Health. So I am very passionate about tobacco control. I love coming to work every day. You can bring all kinds of disciplines and sectors to this topic, and they all provide value to help us improve health and save lives. So thanks for joining us.
Thank you, Dr. Cohen, for sharing your background and your passion for this subject. Today's agenda will include a brief introduction on tobacco control. Program details will be shared along with the curriculum. We'll talk a little bit about what online learning looks like here at Johns Hopkins School of Public Health with our 20+ years of online learning experience. Faculty will be highlighted. I will cover the application process as well as the admission requirements. We'll explain the scholarships and touch on financial aid. And at the end, we will allow some time for questions and answers. So if you have questions throughout the presentation, please type them in the question and answer box, and we look forward to addressing those questions.
Great, thank you so much, Kelly. So I'm going to tell you a little bit more about the certificate program in global tobacco control and start with a brief introduction to the topic area. And we have a quote here from Scott Gottlieb, who was the commissioner of the Food and Drug Administration in the United States for a number of years. And he said that cigarettes are the only legal consumer product that, when used as intended, will kill half of all long-term users. He's not the first one to say that, but but clearly it's recognized at the highest levels in this country, and it has been around the world. So tobacco use is the #1 preventable cause of death in the world. No one needs tobacco to survive. Unfortunately, these products are projected to kill 1 billion people in this century. And the real, the numbers are so big, it's really hard to understand the magnitude of the number of deaths, 1 billion people. And the tragedy really is that every single one of these deaths is completely preventable. There's no need for one person to die from tobacco use. We don't need tobacco to survive. And it really is a tragedy. The problem, how have we gotten here? Well, the problem is the tobacco industry that shamelessly continues to target children, to obstruct the enactment and implementation of evidence-based tobacco control policies at the national level, at the state or provincial level, at the city level, and even at the international level. And they are developing new nicotine and tobacco delivery systems that also result in harm. So the World Health Organization's Framework Convention on Tobacco Control is a tremendous touch point for countries around the world. It's the world's first international public health treaty. It has been ratified by 182 countries in all regions of the world. This is the most widely updated United Nations treaty of all treaties. And it lays out the evidence-based strategies that countries can use to reduce tobacco-caused death and disease. And here in the United States, since 2009, we have the Food and Drug Administration that has regulatory authority over tobacco products. And because of that, tobacco regulatory science has become an important field in the United States and elsewhere, focusing on how these regulatory bodies can best regulate tobacco products. Next slide, please. Great. So I've told you a little bit about the burden that tobacco use and tobacco products place on nations and communities and families. And it's our job to train the next generation of tobacco control experts to lead this dynamic field now and into the future. So there are many skills that are helpful to succeed in this field, including both qualitative and quantitative study design and analysis skills, strategic communications and writing. Leadership skills are essential because this is also a political issue. And implementation ends up being really important in this field. It's a real challenge to have jurisdictions pass tobacco control policies. And that's one of the reasons is because we've got a very powerful and industry with strong financial resources behind them that are fighting every step of the way to prevent the enactment of legislation. But once a country or jurisdiction does actually put forward effective policies, then the tobacco industry works hard to prevent the full implementation of those policies. So that is really a key aspect of this work, and you'll see that we have a course on policy implementation, including the implementation of regulations. So the concepts that we cover in this certificate program are applicable to a wide range of public health topics, and of course will be of interest to a wide range of professionals, both in public health and medicine, and many and the social sciences and public policy people, et cetera. So here are just a few possible job titles that people have had that go through this program, and others. So you can be a scientist, an analyst, both for programs or policies. This is helpful for epidemiologists, for behavioral scientists, and also for, especially for people working in government. Okay, next slide, please. This is a 1-year certificate program. You would do the program part-time, so you can still work full-time and do this certificate program. And the curriculum is offered 100% online. So you don't have to leave your family, leave your job to take this program. You can do it from the comfort of your home or your workplace. There are 25 credits over the course of 4 terms, and you would do 2 courses in each term. We focus on applied learning because this is an applied science. The theory is great, but in the end, we're all here because we want to make a difference. So all the courses have that applied component. You'll do group learning, some peer assessment, and it's very skills oriented. The projects, the assessments, the assignments, the focus of our lectures are all focused on the real world, and we try and do assessments and assignments that will give you that hands-on learning experience. The goal of the certificate program in global tobacco control is to provide formal education to research scientists and public health professionals that will equip you with the technical skills necessary to develop and effectively communicate the evidence that is required to support effective tobacco control policy development and implementation. Next slide, please. So this is a summary of the curriculum and the courses that you'll end up taking. So first, there's a prerequisite that you'll do just before the other courses start. It's an introduction to online learning at the Johns Hopkins Bloomberg School of Public Health. So it just introduces you to our learning management system, how to get online, how to do the things you'll need to do to access your courses and communicate with your instructors. And then we have 4 8-week terms. In the first term, again, there's an academic and research ethics course that you're required to take, as we require that of all graduate students at the Johns Hopkins Bloomberg School of Public Health. And then specifically, the tobacco control courses that you'll take are the ones that follow. So you'll be taking a course on global tobacco control, which really gives a great overview of the tobacco control field and history. You'll take a course on strategic communication planning, because communications is so key to this work and to making progress in this area. And our instructor who teaches this course is really one of our star instructors. Everyone loves him. Well, everyone loves all of the instructors, but he is particularly special. And then in term 2, after the first 8 weeks, you move into the second term, and you'll cover tobacco regulatory science to really think about sort of the principles and the actions to regulate tobacco products. And you'll also take a tobacco control leadership course. And then in the new year, in the third term that starts towards the end of January, You'll take a course on quantitative methods for tobacco control, and a professional development workshop, particularly focusing on writing. And then in the fourth and last term, you'll take, actually this is qualitative methods for tobacco control, and you'll take the course on implementation of tobacco control policies and programs. Okay, next slide, please. So in terms of the online learning, this program has been designed in collaboration with us, the Institute for Global Tobacco Control. Our institute was established in 1998 by John Samet, the inaugural director of the Institute. And our mission is to prevent death and disease from tobacco products by generating evidence to support effective tobacco control interventions. The curriculum is led by experts in the field who are shaping tobacco control policy and practice through their research and through their practice. The courses are developed in collaboration with the Bloomberg School of Public Health Center for Teaching and Learning, who have a lot of experience with online courses, so there's a high production value. The online course activities are designed to keep you engaged throughout the program. So there's a lot that you do on your own, on your own time, although within that 8-week term, but there are also live talks where you can interact in real time with the instructor. So there are recorded lectures as well as those live talks. And there is technical help offered 24/7 in case you run into any technical difficulties. All right, next slide, please. So we've got a terrific faculty. I have the privilege of directing the program, but the faculty are listed there as well. So Dr. Ryan Kennedy, an associate professor in the Department of Health, Behavior, and Society, teaches the Tobacco Regulatory Science course. Dr. Lauren Zaplicki, who's an assistant scientist in the Department of Health, Behavior, and Society, teaches the course on qualitative methods. Dr. Fran Stillman has been involved in tobacco control for many decades, and she teaches our Term 1 course on global tobacco control. Steve Tamplin is an associate scientist in the Department of Health, Behavior, and Society with, he's had an illustrious career at the World Health Organization and at Hopkins, and he teaches our leadership program. Dr. Kevin Welding is an assistant scientist also in the Department of Health, Behavior, and Society. He has his training in economics, and he teaches the course in quantitative methods for tobacco control. And Dr. Connie Ho is an assistant professor in the Department of International Health, and she co-teaches with Nasreen Jassani the course on policy implementation. And just a couple more words about the Institute for Global Tobacco Control. So we are a collaborating center of the World Health Organization. We are a partner in the Bloomberg Initiative to Reduce Tobacco Use. And we have funding from the Robert Wood Johnson Foundation, from the Monday campaigns, and from a number of other sources, including the US Food and Drug Administration and the US National Institutes of Health. Next slide, please. Thank you.
Thank you, Dr. Cohen, for sharing the need for these skill sets and the details of the program. I'm going to touch on admission requirements. We do use a centralized application portal called Sophis Express. Some of the requirements to submit your application include a bachelor's degree from an accredited college or university. You would upload a current resume or CV. 3 letters of recommendation are needed, and at least one should be talking about your impact, your role in the tobacco control field. For our international students, you may need to show proficiency in English. And international academic records must have a course-by-course evaluation through WES or World Education Service. The tuition currently is $1,197. There is an OPAL scholarship that is automatic for those who get accepted into the program. 460 is applied per credit hour. So that means the cost to the student is $737 per credit hour after the partial OPAL scholarship is applied. So at 25 credits in this program, the current investment is $18,425, paying for those credits in each 8-week term. For students from low and middle income countries, you will be considered for a limited number of full IGTC scholarships that, again, is full tuition coverage. So again, applicants from low and middle income countries are eligible to apply. The admission application, again, serves as a scholarship application, so there's no separate steps. There is 3 short essay requirements, and those questions are posted on the website. The Financial Aid Office does provide assistance with federal and private loans. And the tuition rates and the scholarships are reassessed each spring for the upcoming fall term, and those will be posted as well on the website. So applicants are reviewed at admission deadlines, once your file is complete. The deadlines do vary depending on the scholarship eligibility. The IGTC scholarship applicants must submit all application components except for WES evaluation by January 15th of 2021. So we do encourage you to apply early. All other applicants must submit your applications by July 1st, 2021. So now we'll open the questions that you have put in the question box. If you haven't typed your question out, now would be a good time to do so. So the first question is, how is online different than in-person learning?
Sure. So maybe I'll start, and Kelly, you can add to that. Well, I guess, it's not that different in the COVID-19 environment. You're basically with your laptop or your phone, your computer, and you're able to go through the courses, go through the recorded lectures on your own time, do the and then, as I said, there are live talks for each course where you can join synchronously with the instructor and have a real-time conversation. But I guess that's the main thing. You're just not physically in a room with your with the instructor and with your fellow classmates, but otherwise the content is the same. This certificate program is accredited, so we had to go through quite a rigorous process to be able to become a certificate program. So the quality of the courses is just as high when it's online as when it's in person. Kelly, did you want to add to that?
I think that with our extensive experience with online learning, the curriculum is designed for online learning. Professors know how to teach online. And we've been doing online learning for so long, we've created our own platform. So that's very interactive as well. And even though I'm with students up to about when classes start, and we have somebody else on our team that picks up for any registration questions, I do hear back from students And the things I hear are the quality of the interactions with the professors and your fellow classmates, and how much they are enjoying the program. The next question, how much time would I need to dedicate to this program? I don't know if you want to touch on that, Dr. Cohen. How much time should they carve out each week in taking the 2 classes in each 8-week term?
Yeah, sure. So this is, it is work. It is a lot of work, and you would be taking graduate level courses at the Johns Hopkins Bloomberg School of Public Health. So it does require time and effort, because at the end, you get Johns Hopkins credits that you can apply potentially to other, future learning, potentially. So what we say is that it really requires about 18 hours combined for both courses that you would take each term per week. So it's a significant amount of time commitment, 18 hours per week for the both courses combined. And that includes listening to the lectures, doing the assignments, participating in the live talks. So I just, it is a time investment, but of course you get a lot out of it at the end.
And I think when you're passionate about the subject matter, that time goes pretty quickly. It's something that you really want to get in and learn and participate in the program. The next question, am I eligible to apply if I'm currently doing a PhD, but it will be completed before the course starts in the fall?
Yeah, so Kelly went over the eligibility requirements. So you need at least an undergraduate degree, a bachelor's degree, but beyond that, you can have a range of degrees. We have accepted people with PhDs into the program. It depends. I mean, what we want to make sure, because this is a time commitment, we want to make sure that the program will add value to what you already know. So if your PhD, if you're well versed in tobacco control policy and you did your dissertation with respect to tobacco control policy, and maybe at that level where you've been totally immersed in it for a number of years, maybe this program won't be as valuable to you. But depending on, just having a PhD does not preclude you from being accepted, and even from getting the scholarship if it's determined again that this will add value to your training.
I have a question on what kind of support students would have access to, resources, questions about assignments. How does that work?
Just in general, well, every instructor is a little bit different, so they will lay out the expectations for their course at the beginning of the course. So they'll have different kinds of assignments. The resources, again, everything that you'll need will be available online. There are no books that you have to purchase on your own. Everything will be available through the learning management system. The assignments, again, you sort of access the assignments there. You upload your assignments through the learning management system. Each instructor will lay out at the beginning what, again, their expectation and what's needed for the course. Did you want to add to that, Kelly?
The online library access, can you share how that works?
For Hopkins per se, in general?
Yes. How does that work as far as access to library resources?
Yeah, so we have at Johns Hopkins, we have access to a plenitude of journals and resources that are online. So when you are accepted in the program, you become a Hopkins student and you get access to all the Hopkins library system while you're a student. So you get free access to all the medical journals, social science journals. You can be searching for books as well. Obviously, if you're, at this time we can't do interlibrary loans for books, but yeah, access to all the journals. So just in and of itself, that's a tremendous resource.
Yeah, so I think I think that answers the questions as far as what kind of support, what do they have access to being an online student. It very much has a campus feel, the way that the online program has been designed and the resources that you have. The other question that I'm seeing now is how many applicants can receive the IGTC scholarship?
Well, it changes every year. We'll have to see what our funding allocation is for the coming year. But I would say if you are a strong candidate from a low and middle income country, you will get the scholarship. We haven't been in a position where we had to turn people away from a scholarship because we didn't have enough. I mean, we are looking for strong candidates, and we're looking for people who are going to succeed, do well in the program, that it will add value to them, and that they will be able to bring experiences and their experiences and knowledge to their classmates as well. So I wouldn't say that that's a limiting factor. There are scholarships available. So if you're interested, I would encourage you to apply.
And encouraged to apply by the deadline, and just to put sure that you're putting together a strong file. Could you share a little bit more about some of the types of assignments, what that looks like?
Oh boy. I am not in a position to do that. I apologize. Again, each course is unique. So we can get more information about that. It's really, yeah, because I'm not teaching any of the specific courses. So the specifics around the assignments, I can't tell you at this moment, but you can reach out to Carla Clemens. I don't think her email is here, but if you go to our website, if you just search for the certificate program in global tobacco control and Hopkins, you will get our website, and you'll find the email for Carla, who runs the program, and she will be able to answer questions like that.
And also on the website, you can read course descriptions to get a little bit more detailed idea about what you'd be learning. And I think the Introduction to Online Learning course is something that's very helpful to get an idea of what the classroom looks like and feels like. So that's something that is also on the website. Does this program have to be completed in 1 year?
It does not have to be completed in 1 year, as long as you're not receiving the IGTC scholarship. If you're receiving the scholarship, then you are required to complete in 1 year.
Okay, that's helpful. And how long does it take for the IGTC scholarship recipients to be notified after January 15th?
Oh, Carla, I might have to call on Carla about our timeline. So basically, we get the applications, we have to check the completeness, and then we have a review committee that will review the applications. We might reach out to you for a brief interview if we just to learn a bit more about you. And then, sorry, Carla, when in general do we let people know?
So the deadline for applications are due January 15th. And then our review committee meets early February. So if we need any additional information to you during the application process, then we'll reach out to you during like middle of February, and then we should hopefully aim to have decisions by beginning of March.
Okay, so thank you. So March, we would let folks know. Yes, and then the program starts in the fall of 2021.
Yeah, thank you for sharing that. 3 recommendation letters are mandatory. Who should they be requesting those recommendation letters to?
Yeah, so it would be, again, if, so you want people who can talk about your passion and your interest and your accomplishments in tobacco control, if you have someone who can speak to that. If you are applying for the IGTC scholarship, if you have someone from one of the Bloomberg Initiative to Reduce Tobacco Use partner organizations who can write a letter, that would be very helpful. And yeah, so I think people who can speak to your accomplishments, to your passion, to your potential as a leader or contributor to the field of tobacco control, those are the types of reference letters that we're looking for. People who sort of know you, who've worked with you, and who can give some specific examples is always really helpful.
What is the minimum level of English language skills required for this program?
Yeah, that's a great question. So I don't know if I can answer the minimum level, but as I've said, these are graduate level courses at the Johns Hopkins Bloomberg School of Public Health. The instruction is in English and you submit your assignments in English. So I know it can be challenging for people because so you have to have the sufficient listening skills, so to be able to understand in English what the instructors are saying in the live talks and in the recordings. And then your level of written English has to be strong enough too, because the assignments are generally in writing. So, and some of the courses require presentation, so your oral skills have to be good enough. Now we do take into account that for those who English is not their first language, we take that into account. But at the same time, you do have to be able to communicate effectively in English.
The application fee is $50 when someone they don't need to pay $50 to start the application, but to submit the application. Is that waived for the IGTC, or is that a requirement?
Carla, can you just confirm that?
So that is not waived by the scholarship.
Okay.
Sorry, it is not covered by the scholarship?
No, the $50, in order to submit your application, that is the only cost.
Okay, right. So you do have, everyone has a $50 application fee that they will have to pay to apply.
Sophos Express may have a limited number of waivers. So that's something that the student could explore through the application portal, Sophos Express. Do you work with government bodies across the globe?
Yes and no. I would say indirectly for us, because we're in the United States, and it's not really for us to lobby or have discussions directly with other governments. But we work with a whole host of partners around the world, academics, people in civil society, journalists, et cetera, who are more appropriate to be talking directly with their own government. So we support that work. So I would say indirectly.
Are there any guest speakers that lecture in the courses? Any agency speakers?
Yeah, we do. I think, and again, maybe Carla has more information. I know in our tobacco regulatory science course that Ryan does have regulators. I think at someone from the FDA, he might have someone from the Canadian government as well, do guest lectures in the course. I'm not 100% sure about the other courses. Carla, do you know?
I think as a part of some of the recorded lectures, some of the other courses do include guest lectures as a part of their lectures, but I don't know specifically exactly which courses off the top of my head right now.
What is the relationship between this course and online global tobacco control learning from the experts?
Yeah, great. So we have a free online course called Global Tobacco Control Learning from the Experts. It's free. It's available in English, French, Arabic, Chinese, or Mandarin, Portuguese, Vietnamese, Spanish, maybe one or two other languages. So that is a terrific introduction to tobacco control in general. It's free. It's all online. I think it's a terrific course. We updated it recently. But the certificate program is at a whole other level. As I said, these are graduate level courses that you would be taking at the Johns Hopkins Bloomberg School of Public Health. So you don't get like a certificate of completion for finishing it. You get a real, like an accredited certificate from Johns Hopkins University. When you complete the program, you get a nice diploma as well from the university. So there's a big difference. These are graduate level courses that you are in the certificate program in global tobacco control. It's these are graduate level courses. You're working with your classmates and the instructor and the teaching team as well, including the teaching assistants. You're doing more involved hands-on assignments. So it's at a whole different level. This is a much higher level of learning, and so I think both are great, but they are different.
Someone is asking if you have additional questions, can you reach out to my email address, which is kcurti11@jh.edu. Yes, we do have a dedicated admissions team here, and definitely reach out with any additional questions that you may have. I think that is all the questions that we have for now. Dr. Cohen or Carly, would you like to add any closing comments?
Yeah, I'll just say thank you so much for joining today. We really encourage you to apply. I think we've had a great cohorts of students. We've been offering this certificate program for many years. And once you become an alumni of our certificate program, there are some other learning opportunities available to you as well, and you become part of the Institute for Global Tobacco Control extended family. So please reach out to Kelly if you have questions about the application process, and then anything very specific about the program itself and the courses. Carla is the person who knows everything and can get the answers that are specific to the content. So please don't hesitate to reach out along the way. All of these questions that you asked were great ones. And so any additional questions about your application or how to strengthen your application or the types of people that we're looking for, like, please don't hesitate to reach out to us and ask any questions that you have. We'd be happy to answer them.
Again, thank you everyone for attending the Global Tobacco Control virtual open house. If you are excited about this program and see this part of your future, feel free to use the scan codes here on the last slide to move forward with your application, or do reach out to us. We have a dedicated team here to provide assistance. Thank you.